Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're back, and we're thrilled to bring you another episode. For this snapshot, we're going to be focusing on two topics. First, we're going to talk about the importance of professional socialization, and this is going to be relevant for both the CNE clinical, the CNE novice, and the CNE exam. If you're not familiar with some of the content that's listed in the competencies, for CNE CL, it's going to be under competency 5. And then for the CNE and CNE novice, it's going to be under facilitating learner development. And there are a couple of different sub-competency areas that this is going to be relevant to help you answer those questions correctly that come up on the exam. If you have questions, you can always reach out to us at info@drsellerseducate.com. Our website is drsellerseducate.com as well. So let's go ahead and jump into our content. We are going to be sharing, of course, information that is evidence-based, that is aligned with the content recommended by NLN as you all get ready to sit for the exam. If you are unfamiliar with the requirements for the exam, I encourage you to go ahead and check out the NLN website. You can go to nln.org, and then at the top, if you click on certifications, you will see information and hopefully answer to all of your questions related to the certification exams. The NLN is also available for you to contact them if you have additional questions. This is the reference that you can use to help you better understand some fairly recent research. This was actually about 8 years ago, which is hard to believe. This was a study, a qualitative study that looked at the impact and the influence of specific factors to help acclimate nursing students or even new nurses on a nursing floor into the environment. So when we talk about professional socialization, what we're honing in on are those specific influences and challenges associated with nursing students transitioning into the profession. In nursing, we want to pay specific attention to our professional identity. We want to protect it. We want to role model these behaviors for our students that we expect of them so that they understand the importance of behaving like a professional. Our first step in doing that as a faculty member is through our syllabus. This is going to allow us to talk to students about expectations that we have of them as far as the measurements that they will be tested on and our commitment to support their learning throughout the course. Other factors that are associated with professional socialization include relatability. So can the nursing students see themselves on that particular nursing department? Are we seeing good role modeling behaviors of nurses on that department? If we're not, we want to take an opportunity to discuss that during post-conference with our students. We also want to talk about some tacit knowledge with our students. We know that cognitive knowledge, the development of critical thinking, clinical judgment are all very important in the healthcare setting. When we look at theory to practice integration, nursing students can sometimes see some gaps in the practices that they see and what we're teaching them in the class. As much as we can close those gaps so that the teaching is consistent, the better position our nursing students are going to be in to apply these concepts that they're learning about in the classroom and that they're seeing firsthand in the clinical setting. We want to break down a little bit more detail related to this specific competency, looking at how we facilitate our learners' development and socialize them into the nursing profession, but also into the learning process. We do that in a number of ways. These are 6 categories that we have identified that really do support the framework of this competency. Mentoring learners, we want to demonstrate those professional behaviors. We want to talk about the standards of nursing practice. We want to talk about the code of ethics that the nursing profession has established. When we think about the learning climate, we want to talk about, again, during the syllabus review, the standards of behaviors that we expect of our students. We want to refer to the student handbook and talk through some of the examples we may have to share with our students about expected behaviors. Professional integrity and accountability, talking about the challenges that are associated with delegating responsibilities, for example, in the clinical setting, and how we work collaboratively with our healthcare partners to ensure patient care is delivered in the best way possible. Those professional boundaries, talking about how we communicate and collaborate across disciplines using our evidence-based strategies such as the SBAR tool to communicate any change in patient conditions, or even to communicate during tough conversations with our colleagues. Professional development, we are committed to lifelong learning. We want to emulate that and to recommend that to our students. That can be something as simple as us sharing with our students that we are on our journey to achieve certification as a nurse educator, and talk about the value of that. And then we want to assist our learners, helping them understand the importance of doing that self-assessment to completing those reflections during their journaling or during discussions post-conference, to be able to identify our own gaps and to develop a roadmap, if you will, towards self-improvement and how we will provide better care to our patients the next time. All right, so I know that was a lot of information, but we want to just pause for a second and share with you a very exciting opportunity that we have put together for many of our nurse educators out there who have had certification on their list for a while. We still see the report. Now, this is from 2020. We're waiting on the final report from NLN for 2021 pass rates, but 69% for CNE, 74% for CNE-CL. Many of us spend a lot of wasted time and resources because we delay taking the certification exam. I know I did. It took me 5 years before I committed to sitting to take the exam. All right, well, we're on a mission to help you through that, right? We don't want you to continue to procrastinate. We have heard from many of you all on your journey who have already been successful. So congratulations to you all. We're super excited to share just 2 of our testimonials during our snapshot today. You can see here from Miss Loretta Hall and then from Jen, how excited they were that they discovered us and how we helped them on their journey. Our business site is also posted on Google, and we have 4.9 out of 5 stars. So we encourage you to go over there and see what others are saying about our programs as well. We are launching a new webinar this Thursday, May 26th. If you are watching this YouTube when it's released at 3 p.m. Eastern time, we're going to talk about what you need to do to achieve your CNE in 60 days. So that's for all of us that are on this journey, whether it's the CNE, CNE-CL, or CNE novice. We know that for the novice exam, there hasn't been updates released yet, but we anticipate those soon, and we want you to be ready. So no more procrastinating, right? We're going to get this marked off of your list. Join us on May 26th so we can talk more about how you're going to do that. How are you going to achieve this goal within 60 days? You can absolutely do it. We've seen it over the past year and a half almost with our nurse educators we have worked with here at Dr. Sellers Educate. So you can do it too. We know that anything worth having takes time, commitment, and focus. With these 3 elements in place, with a few extra resources that we're going to talk about on Thursday, you too can join the 60 Club is what we're calling them. All right, so let's jump back to our content as we wrap up for our time together during this snapshot. In talking about these professional nursing behaviors specifically and standards, we should serve as a professional role model, having discussions with students that may be difficult for them to understand as it relates to conflict, and how do we work together with our other disciplines to ensure we are all on the same page, and that ultimately our patients and our families receive the best care possible. We want to establish those boundaries, right? We want to be able to talk about how we manage our stress with our students and encourage them to share that as well. Taking the time to care for ourselves. We can't pour from an empty cup, so we want to definitely reiterate these self-care practices to our students to help them cope as they self-reflect on their practices. We want to encourage them to use mindfulness, meditation, and other relaxation techniques to help them through the challenging times. We have a framework. Did you all know that we had a framework? Well, we do, and we're excited to talk just a little bit more about that in this snapshot, and there's a whole dedicated snapshot in itself where we talk about in detail our framework. So if you haven't purchased your resources, okay, that's one section of the framework. That's an important triangle. The experience, you can look at what NLN states. This is a little bit higher standard. Again, this is Dr. Sellers' Educate framework. We recommend, based on nurse educators that have been successful, that you are more likely to be successful if you have 3+ years of nursing education experience. Now, does that mean you can't be successful on the exam? You absolutely can. And several nurse educators have been. So don't be discouraged, okay? Just means that you're going to have to work a little bit harder, which again, we can talk about that at the CNE in 60 Days webinar on this coming Thursday at 3 p.m. Eastern. And then support. You need support. Mentoring, coaching, that is so important for you on your journey. That's how we all stay on track and cross the finish line. And then last, we want to thank you. Thank you for taking your time today to go over some of these key important elements with us as it relates to professional socialization and the impact that we as nurse educators have to help our next generation of nurses who will be taking care of us. Okay, so that's our time for this snapshot, and we hope to see you on Thursday, and you can always reach out to us. Again, we are info@drsellerseducate.com, and have a great rest of your day, everybody. Thank you so much. Bye-bye.